Basically, we work inside the healthcare system, trying to drive down their supply chain costs, which is drugs and everything that they use in healthcare systems, and also improve the clinical performance of healthcare systems.
You've helped about 350 hospitals save about $18 billion.
Yeah.
And how does that trickle down to the consumer? Does the consumer's cost get reduced as well?
Well, our footprint is 4,000 hospitals across the United States and 165,000 providers. So to the extent that we can help them aggregate their buying and lower the cost of care and improve quality, the consumer benefits from that.
When you see something like Berkshire Hathaway, JP Morgan, Amazon teaming up to try and lower their own healthcare costs, is that a sort of threat to the type of business that you offer existing companies, or is it in fact something that kind of backs up what you're already trying to do?
Yeah, it's really helpful to us and we're helpful to them. So if you think about these major employers, the question is, are they going to have a Netflix effect on insurance companies? Meaning they're going to go direct to providers, health systems, hospitals, physicians, and they're going to try to lower the cost and improve the quality directly. And that's what we do. So it's helpful.
So are you working specifically with them? And as a follow-up point, do you think they have gone into this optimistically and as 6 months has passed, found out actually it's a lot harder to do than they kind of initially hoped?
You know, they're not the only ones. So major employers like Disney and Walmart and others have been going direct to providers for a while. We have several of our health systems who have those contracts directly. And I think that the challenge they have is they need to get directly at how care is being delivered and get rid of duplication and coordinate the care. And I think they're frustrated with an insurance company's ability to do that. And so we have mobilized and are continuing to mobilize our network of healthcare systems to go direct. But in order to do it, you have to have data, you have to have information, and you have to be able to create national standards of what it should be.
Is reforming healthcare, you know, it seems right now that the biggest strides or the biggest strides are trying to be made by the private sector. I mean, Wolf had mentioned the Berkshire Alliance. Companies going directly to the insurers to demand better rates for their employees. I mean, is that the way it's going to be? Is it going to be driven by the private sector, or is there a role for government?
You know, I think market forces work best. So if you're talking about drug pricing, or you're talking about coordination of care, or you're talking about employers lowering their cost of care, going direct, I think, is the most effective. I think federal and state governments, Medicare, Medicaid, have a role to play in standards and in protecting the clinical quality in some ways, but I think market forces work better when you're trying to lower costs and improve quality.
Sorry, go ahead. There has been that role of market forces driving down the price of drugs. I mean, with Scott Gottlieb, a lot more drugs are fast-tracked in terms of approval. Generics are moved faster to market. In this whole discussion about drug prices, though, are you concerned at all that perhaps the drugs that are the unique drugs, the drugs that don't necessarily have a replacement, are being swept up in this as well, and that will really sort of impede Big Pharma's ability to research and develop these drugs in the pipeline?
You know, the last thing we want to do is stifle innovation. I think what we need to do is create market competition, and it's proven, and Premier knows it. You have to have two competitors to get that pricing to be competitive. And so Dr. Gottlieb has made great strides in moving generics to faster approval. He's creating and closing some of the loopholes that pharma uses. So it's not a question of should they be able to have some protection for some period of time for their innovation, because you don't want to stop that. You've just got to have a reasonable time to let competitors enter the market.